It looks like we're good to go. So I'm going to go ahead and pass it over to you, Kathy,
Okay.
our elected chair stand-in. Thank you very much.
Right. Well, as many of you are probably aware, Pazit could not be with us today, but I know that she expresses her good wishes that we will end strong here as we are in our final meeting today, and we'll be having a breakout session coming up. You can see the agenda on your screen, and looking at having 55 minutes for the breakout groups to finalize recommendations, and then another 20 minutes to report out to the full group. And really at that point, just making sure that you're highlighting things that were changed from our previous meeting. And then whatever our next steps are. So I'm really looking forward to participating, and in this has been really exciting to have been invited to attend and be part of the Build a Longevity ecosystem. And so for that, I'm grateful to MDOA, and I'm sure you all feel the same way. It's been a nice opportunity to really be able to impact how Maryland moves forward. So thank you for that to MDOA. Thank you for all of you who have been so faithful at attending these meetings and providing your wisdom and expertise and your brain power in this as we're thinking through these things. So just thank you very much, because it certainly has been an honor and a pleasure for me, specifically to get to know the folks on the team that I work with. So thank you very much. And goodness gracious, Chuck, you have a question.
Yeah, what's the process after we make the recommendation? How does it work?
Okay, Liz, can you speak to next steps on that?
Yeah, we are going to get into greater detail on that later. As you can see, it's the last item on our agenda to really say, you guys have done this great work. What are the next steps here? Broad scopes. The next steps are that we're going to be reviewing the recommendations of the Department of Aging to see if there are things that we're required to include that aren't included there, to add in some elements around our state plan requirements from the Administration for Community Living, and really to look at how all of the pieces of the plan work together, and if there are any gaps from our perspective. Then we're going to be putting it into sort of the vetting process, really bringing together leadership from state agencies to talk about the strategies that have been identified that are really in their camp. Are these things accurate? Are they reflective of the capacity of the state? Are they the things that will be most effective for systems change? And then we'll really, after we kind of go through that process and do that vetting, we actually have found some additional time within our timeline to make sure that we're coming back to you guys and saying, look, here's what we've done with the recommendations you've provided. And we'll share additional details about that via email. And I'm going to be talking about it a little bit at the Stakeholder Advisory Group, which is next week. And it'll be kind of like our final closing meeting for this process. But really putting out via some kind of internal town halls now, sharing what we've done, where we're going. Then from there, we have a drafting period, a review period, and then we'll be putting it out for public comment in the spring. So we've been able to shift our timeline a little bit to make sure that we're not competing with the many, many demands of the very beginning of the calendar year, and being able to do that public comment a little bit further in the spring, so around March. So please, if you're not signed up for our list for Longevity Ready Maryland, please sign up. We'll also be kind of emailing you directly with next steps. But that's the broad scopes of where this goes from here. And we can talk a little bit further about that, towards the end of the meeting.
Thank you, Liz. I appreciate that. And we'll look forward to hearing, again, a little bit more about next steps, because this is really quite the process. And that said, it's also quite the opportunity that the Maryland Department of Aging has, certainly through the executive order. So here we go. So I'm looking at the time, and Chelsea, I'm thinking maybe we will reconvene at noon. That'll allow us that 20 minutes for the report out, and again, the 10 minutes for next steps. Okay.
Sounds good.
Can I say before we go over there, our goals in these meetings today are really to build upon the great conversation that we had last time. So folks really said, oh, I need a little bit more time to look at this, to work on the language internally. And so Pazit said, okay, let's spend our final meeting working internally. So that's what we're going to do. This time is for you to work within the template to finalize your objective, up to 8 strategies, and then to add whatever supporting information you think is relevant and important for the department to know as we're taking these strategies and looking at how they kind of come together as a whole across all work groups. So just reminding us of our template and trying to work towards that. And then when we come back together, we'll kind of give broad strokes back. Here's some of the comments that were made, and here's how we shifted. And then we'll finalize our process here. I just want to make sure we knew that's what we're doing.
Corey, I'm on a conference call. I'll call you back tomorrow and later.
Perfect. Hey, thank you very much. Okay, so we have clear guidance for the next maybe 50 minutes here. Clear guidance on what we need to accomplish. Okay, thank you so much.
So are we ready?
Yes.
All right.
Mhm.
I think I put everyone in their right room.
On at the last meeting. Amazing job, John, presenting our strategies and so eloquently and clearly. It was really awesome.
Thank you.
Echo that.
Happy to step in.
Guys, I just want to, this is my first time, I think, in this little group. I'm Sean Brennan with Montgomery County Age Friendly. So I'm happy to jump in. Sorry, hope I don't ask too many stupid questions.
Sean, there's never such thing as a stupid question from you. I know Sean for a long time through the Maryland Aging Network, and also with her work with me on the Maryland Senior Citizens Action Network. So happy to see your face.
Thanks, Carol.
And hear your voice.
Wonderful. Should we start? I think we were sent an updated link with our recommendations. I wonder, is it worth going through that? I actually this morning went through and added some comments to be taken with a pinch of salt, potentially. But thinking about the last conversation we had and some of the feedback that we've received, I don't know if anyone else has got any comments or.
I was concerned that, one of the outreach groups I mentioned, maybe it was rejected, was local practitioners where people go. And I saw the list went like A through J or K or something, and it never got to local practitioners unless it was implicitly incorporated in item D. But I don't have the chart in front of me now. Can we put the chart on instead of the?
I can share my screen if that would be helpful. Should we do that, or let's see?
Yeah. I currently have 6 faces on there, not mine.
Yeah, I think if you could share your screen, that'd be helpful. Thank you. And then we have to whittle this down to 8, right?
Yeah, that's some of the questions I had. So Okay, I've never shared in a Google Meet, so let me know if this works.
Yep.
So are you guys all seeing the, everyone seeing the,
I can see it. I don't know if there's a way to, if you go to
Make
the 100% over there at the top left, you can enlarge the view.
is that better?
There it is.
Yay. Okay, awesome. So I believe this is the link, the latest link that was sent to us just with our strategies. I think it was amazing. We didn't get a ton of feedback from the group. I don't know what you all felt. I think, John, you said we maybe have to either go to 8 or rank, I heard. Did anyone quite?
Right. Yeah.
Yeah.
We had to prioritize them. You're correct. It wasn't necessarily eliminate, but we had to prioritize them.
They thought our work was so good that it didn't
Yeah.
get a lot of comments. Actually, we did get a compliment on our work.
Maybe we could take a quick run through together just to kind of familiarize ourselves. If anyone has any comments as we go along, and then we can think about potentially prioritizing them. I don't know what everyone thinks of that.
I think that's a great idea.
Okay. So for our objective, one of the things I heard in the last meeting was that potentially we would be eliminating the dates, but I'm supposing that's not up to us. That's going to be a bigger question if all the strategies will have the date eliminated. So should we leave it in there for now?
I think what we had, at least from what I understood, was that we should sort of give a stab at what we wanted the dates to be. And we were pretty specific about wanting some of those things to be very near term and then build on them and they'd continue across.
Okay. Great. So I'll just mention some of the comments I had thought of as we were going along. So I wondered, in our strategies, do we need to speak to this piece more, like the feedback and experience of potential service participants? We haven't called that out specifically, or is it enough that it's mentioned in the supporting information? I'm going to just scroll down and show you where it's mentioned. Number 7. Okay. So here is where it talks about the gathering input from older Marylanders through surveys, focus groups, and community meetings. Do we feel it's sufficient, or do we need to call it out more in our strategies? It's just a thought.
Could we go back up to the strategy and take another look at it?
Yeah. So this was actually our overall objective, but we didn't call it out in any of the listed strategies. We may think about it as we go through if there's a way to.
Personally, I think that we just should keep the objective clean. And then, at least from the perspective of the aging network, one of the things that we must do, and it's required by the Older Americans Act, is to hold area agency plans with very specific requirements for meeting with stakeholders. And we always held like 4 or 5 of those meetings. And then we were always interested in that because the Older Americans Act requires us to do it. So if we kept our objective very clean, that developing coordinated system across government agencies and community-based organizations, period. And then, at least from this perspective of the aging network, that feedback from the service participants is inherent in all the work we do. And I like your idea, Steph, of looking down at the bottom in terms of the fact that, we'd like to emphasize that local strategy. Does anyone have an objection to that?
No, I don't.
Thanks, John. Are you okay with it, Norm? You're the man in the street.
I'm not quite clear on it. You want to go over it again simplistically?
Okay, what we would do is leave the objective by 2030, strengthen the capacity of local governments, organizations, and leaders to support longevity for all Marylanders by expanding and developing a coordinated system across government agencies and community-based organizations. And I put a period there and leave out the informed experience of potential service participants, and then add that requirement to the strategies.
Yes,
I was trying to explain
Yeah.
it that
Yes.
for the aging network, since we know the AAAs are going to be highly involved in this, inherent in our instructions from the Older Americans Act, through which flows our funding, we are required to seek that input from stakeholders and participants.
yes, I think it's much clearer, and I think how we do it is by being informed, which would fall into the strategy category, like you're suggesting.
Okay,
So do you feel like we need to put that language in each of the strategies?
not necessarily, but I think if we look down there, we may find some where it's really appropriate to put it in.
Perfect. Okay. Great. So do we have any updates on the first one? By 2026, increased utilization by 20% of existing resources through marketing and promotion, like the Aging and Disability Resource Centers and the Elder Care Locator, to connect older Marylanders and caregivers with needed services.
So it's really focusing on the activity of marketing and promotion.
That's right, Sean. Yep. And then in the supporting information, we go into more detail about what that entails. Yeah.
No, I think it's very good that you have collaboration as an essential goal, training is an essential goal, and you put it right up front. I think that's very good.
Okay, great. I'll just keep moving on. Anyone just feel free to interject if we're going too quickly. Number 2, begin collaboration starting 2024 between MD Think and MDOA to connect older adults and caregivers to services and benefits around the state.
I think we may need to change that to 2025.
Agree.
Because I mean, they can't really do much before January. So if we put 2025 in there, it indicates that we want them to start right away.
Agree.
So
And
can someone say a little bit about MD Think and what this would look like if MDOA was coordinating more or pulled in or collaborating more with MD Think, Marilyn?
Want me to talk about? So MD Think, are you familiar with what that is, Sean?
Not really.
Okay, so it is a platform that the state created as a way to connect people to services. One, by putting it in one place where they can go. So if you Google it and just look at the MD Think platform, you'll see that it has different types of services that you can access. And then the idea is that if you apply for one of those, then you would also get connected to other services that you might be eligible for and could apply for. And then eventually, when it's kind of reached maturity, it would be a way for, so let's say I work for MDOA and somebody applies for a program at another department, and I get an alert that based on that, this person might be eligible for something that we offer. Then we could do some outreach to that person and make sure they're connected to the services. So that's what it would look like, is to make sure that MDOA and the various services that are under the MDOA umbrella are in this MD Think platform, starting with where, it could start with where they, what they feel is the highest priority and working those in. This is a pretty big project, and it's under the Department of Human Services now, but it's going to move over to DO-IT, I think, Department of Information Technology. And they kind of, the person who's directing it now had a narrow approach to start with certain programs and then widen it from there. I know they've had some preliminary discussions with MDOA. I think the main thing or goal around this objective is to make sure that that MDOA is part of the conversation with MD Think, and they're getting connected to the platform of services that will be listed on the site.
Will the existence of this MD Think be made available to all the appropriate users?
Yeah, I mean, it's already there. You can go on your own and go look at it and apply for something that you might be eligible for. So it's But the key is that MDOA programs are included, and that takes some coordination with the director of the MD Think program.
Sounds really good because to me, what you're saying sounds great because there's obviously been an investment made in the MD Think platform. And I think the average person would assume MDOA programs were part of that, right? It's reasonable to think that they would already think that that was happening. So making it explicit seems pretty smart.
Steph, you had a comment in there. I don't know if you
Yeah, and it's kind of related to Sean's question actually. So the supporting information hasn't been yet updated with everything we talked about in our last meeting. So in general, we do need to update it to reflect. And this is one of the things that we updated. So we don't have the supporting information in there. So that's where we can potentially put a little bit more of that explanation in. And I also wondered, is it worth including in there the potential expansion of MD Think to include community-based organizations, matching people who aren't eligible for the programs that are listed? And it made me think that there's a big overlap with the grassroots group. And they talked about using AI to match older adults with services. So I wasn't sure how we could potentially incorporate that into the supporting information maybe in some way.
Welcome, Jonathan.
Yeah, and then remove I think we need to be consistent, remove the identified barriers there too.
Yeah, and drop that.
Yeah.
And create a plan of action to address. Okay, perfect. All right. Now what Marie brought up was surveying end users. Is that?
Yeah, I wasn't sure what language to use.
Yeah, I
for that,
wasn't sure,
people
but that would be, I probably wouldn't rephrase it that. But what's the group?
Do you want to say surveying the community?
Okay. I think that would be a different strategy.
Okay.
Well, maybe.
So I left out. Are you guys still talking about number 6?
Yes, we changed the language on numbers while you were out. We changed the language on number 6 to identify opportunities and concerns for enrolling in age-friendly initiative at the local level. And then there was a conversation in regards to what if we take the temperature of the folks who use these services or experience with seniors in general, people who are using these services and experiences, what are they most concerned about? Or has that been done already, Liz?
Well, I think evaluate progress seems to cover all the issues that might everything really.
What I'm interested there that I think overlaps is you're talking about who to survey. And I wonder if the area agencies on aging are the target that you guys really want here, or should this be local community stakeholders, local governments? I'm not sure how the model works exactly. That, I would assume that older adults themselves, like in this process, should and need to be involved in the process of becoming an age-friendly model. So I just wanted to put that on. Well, is this everyone who should be part of the process? I don't know.
Right. And I'll have to say the reason, because I wrote area agencies on aging, because I've already been contacted by various area agencies on aging. Now that you're retired, I can tell you how I feel, or something of that nature. And they are concerned about what this means to their workload, and how's this really going to work, and it's just and is it going to be funded? And so there are conversations I think that need to take place there. But using the word stakeholders covers the whole gamut.
Yeah.
Now, would you, Marie, would you feel comfortable about putting just survey longevity ready stakeholders, or how would you like that language to be? Because I know that.
I mean, I think it makes sense to have number 6 be specifically tied to area agencies on aging and associated stakeholders.
Okay. Okay, because I think that covers both, because I really think, and
And I'm sure. Yep.
go ahead, Liz. Go ahead, Marie.
I was just gonna say, I'm sure that they already are conducting surveys of the people who interact with their services. I mean, I'm certain that that's something that takes place, and it's just a matter of, can we, when we survey them, also request that they submit that data?
Absolutely. I think, because yes, those surveys go on all the time. Okay. All right. So let's go. Can you scroll back to the top now that we're wordsmithing this, and I really appreciate that because it makes it better. Okay. Are we good with, by FY 2026, gain commitment of state officials to actively support and implement age-friendly initiatives? Are we good with that?
Yes.
People are, okay. You raised your hand because it was a yes.
No, yes. That's
Okay,
a
you're
yes.
funny. Okay. Let's see. Number 2, FY 2026 and ongoing, build age-friendly statewide infrastructure, staff, and budget to promote and support the age-friendly initiative, provide technical assistance and support. Are we good with that?
Yes.
Yes.
Okay, that's good.
Yes.
Emphatically.
Woohoo! All right.
Can I
let's
just share with the group, feasibility wise, if you're talking about staff and budget, the staffing and the budget process for the fiscal year does tend to happen much, much sooner, right? So we're in that process right now for fiscal year 26 already currently. So it's just something to have on your mind, whether it should be 26 or it should be something else.
Well, let me ask this, because certainly Marcia and I had some conversations about these dates, and honestly, now again, because it made me, the driver is the governor, absolutely in agreement. Here's what we're doing, but you already have an executive order. Is that enough, do you think, to at least put this in the budget, at least like right now? Whether it gets approved or not, I mean, I always found when doing budgets, I'd rather put something in, if it doesn't get approved, then I can say, but we asked for it last year and you didn't get it. Like you're sort of building I don't know how MDOA works with it on a state level, but is it value in putting it in the current budget cycle?
Well, what I'll
Or
say
not?
to the timing is this plan still has many steps to go before it's finalized, and won't be finalized until July of 2025. So I don't think we as a department are in this moment when we have to work on these things because of the timeline, looking to implement these recommendations before the plan is in place. Some of them, of course, we're already working on, but as a whole, I think timeline wise, there are challenges there just in terms of how the state's process folds out and that there is a pre-planning period.
Sure. So you're looking at 2027, probably.
Kathleen, Kathleen, why don't we recommend a study, financing a study in blah, 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 in advance now? In other words, you're not recommending implementing the plan, you're recommending a study, blah, 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 preliminary study of something, funding for a study, whatever.
A study of what? A study of what?
A study of whatever it is we're studying here, whatever it is we want to finance, a study of budget requirements, a study of implementation. In other words, a preliminary study funded. That would get you started financially. I don't know, just a thought. I don't know this whole government stuff.
Marcia, what are your thoughts?
Having been through this process at the local level, I started working on this 2 years before we actually were enrolled. And or we enrolled, but then it took 2 years to get a plan written. So I think the sooner it can, so you need staff in place to do that. That's all I'm going to say. I can't speak to the budget cycle or how to ask for it or anything else, but you need some staff person or people to be working on this to make it happen before it happens, or it won't happen.
Well, that's
Yang,
that makes sense.
We're still talking about the number 3,
we were
or
talking about,
the budget infrastructure part.
we were talking about the number 2, which was the.
Yeah, the stuff and budget part.
So Yang or Marie, do you have you want to share your opinions on that one about?
I think the budget part is hard to predict. I think it's a goal, right? This is a goal, right? This is only the goal. It's not we have to do it, right? I mean, it's not we have to do it. It's the goal, right? What I can say about it is like this is unpredictable for budget things, right?
Right. Well, and we do have a
Does
short
there-
term, 1 to 3 years, as a short term goal.
How about
need to be
in how about in 2, funding for provide funding for staff or technical assistance and staff support.
And Marie, you were going to say something?
Yeah, I was just gonna say, do we need almost a pre-goal that entails figuring out how many people and how much budget, even kind of approximately, like what are we envisioning for how many people will be needed to support the age-friendly initiative at the state level? That feels like something that needs to be scoped out a little bit first.
I think there's a number of other states who could probably provide a lot of great information on that as well. Yang, you had a thought there?
Yeah, for number 2, and I see we do put like the national, state, local, private sector funders. So that is the private sector funders. Is that any overlapping between number 7 and number 2 in terms of budget?
Well,
Well,
I think we're looking for a both and. I feel like it's a both and, that you need a state commitment, but on the same token, you want to supplement that at a national level. I think it's both and. And I think, I've certainly, and I'm sure all of you have been to enough conferences recently where there are funders, national funders that are very much interested in this kind of work.
Right.
So,
So we talk about one is really the government, like a budget there, like state budget there. But the number 7 is really like
outside.
Outside. Okay.
Okay, so let's go back to, let's take a look at number 2 then. And forgive when are the MDOA budgets due? When is MDOA budget due for the next cycle?
So just as state agencies, we work on developing our budgets already this summer before the legislative season. So I believe, and the governor's budget, I think, comes out maybe in December or at the very start of the legislative season. So budgets typically are developed summer to fall and then move into the process for the legislative season, which starts this year on January 8th.
So MDOA has already submitted their preliminary budget to the governor for review.
All state agencies have submitted their preliminary budget.
Okay. And
Okay. Hey, did JJ just join this one?
Yeah.
JJ, we need you.
I mean, Liz, I could talk, and Liz, we can both be looking at the document off.
Yeah.
You
It looks like the way your settings is that if you go to the left-hand side where it says tab, and you see, click on objective hyperlocal, or scroll down and see if you can click on any of that stuff.
It's got me in annotation mode. Stop annotating. Maybe this will help. Never wanted to be in annotating. Sticker.
Oh,
is there
I
anything?
know what's happening then. the reason why I can't see it is because I believe that if it's in annotation mode, it has to be accepted before I can look at it.
No, I edited in Google Docs. I did not edit on this screen. We've not been able to do anything on this screen. So
Oh, are you
and
trying to edit within the call? Oh, you can't do
that,
that.
yes,
Oh,
and or
okay,
be
you
able
can't
to
do that. You
scroll
have to
up
actually,
and
yeah. Unfortunately, you're not going to be able to do that within the call. You're going to have to actually go to the actual Google Docs.
Mm.
Yeah.
but Liz can't see it. She can't see it when I'm doing that. She can't see my edits.
Right.
So
So what you're going to have to do is when you share your screen, you'll just be sharing the screen, but you're actually making the edits within the document itself, not within this call, but in the actual drive itself. Am I making sense?
Let me try to get out of this meeting.
That's why I'm not able to see it, because you're making it within the call and not in the actual document itself. So it's almost like an overlap.
Okay, so I'm in Google Docs right now. Can you see on the call me scrolling up through the document?
Yes.
You can. So
Mhm.
I just have to work off of this doc then, Liz, or
That's fine. It's just, we just can't enlarge the font, I guess.
and I can do that from the actual document, right?
Yes. So you should be able, yep, there you go.
Oh, that's much better. Okay, I can see it.
Okay.
Yes. Thanks, Anne.
Okay.
All right,
Thanks,
so I got
Chelsea.
another.
Yeah,
got
thank
another
you.
bell.
All right.
No problem.
The downside is, let me see if I can move this over a little bit. The downside is, I want to make sure I get the comments in there too. All right. So this is back to this. This is the statement we changed. And then we got down into the comments. I just injected this. This does not belong here. This was the definition I had. And I think, Liz, you were reading and we were figuring out where to put that language,
Yeah.
whatever language we want in these 1 and 2 strategies.
Wondering if we could footnote, because that's a lot of narrative to put in
There's
that.
a lot of words. Yeah.
So if we could footnote hyper local and then, define it as this. Do you think that's possible? Put like an asterisk by hyper local and then have that definition underneath the chart. Does that make sense?
Yeah, let's see if we are allowed to do that. And we have to, and let's decide if this is right, the right definition. Do we need to add these other words?
Hyper local models of community building and aging refer to community development strategies that are focused on specific small geographic areas, such as neighborhoods or even a collection of individual houses to address the needs and concerns of all. Result.
And she's got move including and state hyperlocal. They want to remove the including portion, and I think that is an add state hyperlocal organizations that provide assistance to older adults to easily access, coordinated, prioritize. Well, it says the same thing.
Mm-hmm.
Let's see that. I like cater to, because it's not just assistance, it's, we're trying to, the ecosystem isn't just about services, it's everything.
Yeah, exactly.
It's setting up your environment
Right.
to be friendly and so forth. So, so we want to see if we can include this somewhere else.
And like you said, that you're attracting maybe not singularly organizations that all just typically serve older adults. It's all,
Exactly.
you know, there are a lot of organizations that serve the neighborhood where older adults live.
And need to be networked in.
Correct.
To, I mean, that's where the magic happens. I mean,
Correct. Because a lot of these organizations don't realize that they have an older adult component to it. Because they just, you know, I'm amazed how a lot of these resources and stuff just are not shared. You know, people just aren't aware. You know,
and some of the literature I read, some models I read, literally have every single resident's phone number, email if they have it, you know, special needs. They have that at hand, so that if anything ever happens, they know how to mobilize and what to do. That's what I think we're talking about here.
Exactly. Those are the model, like the emergency response model. Yes, exactly. Yeah.
Okay. So, we go back over to the doc. So what language in 2 and 3?
So Liz said something about, she highlighted challenges. So she said, oh, challenges in meeting increasing needs. I guess that's because as people, because of the population aging. I guess that's what she means. To me, I guess I because I'm in aging, you know, that's just an assumption, but I don't know if that has to be further defined. Meeting, evolving and emerging. So she's saying funding sources and evolving and emerging challenges. Yeah, we could just add that, evolving and emerging challenges in serving diverse populations. That's under that last line in 2.
Includes understanding their existing resources and funding sources. In support.
Existing resources, funding sources, and evolving and emerging challenges in serving diverse populations. Just those adjectives.
Does that read better? Let's see.
Yeah, that reads great.
Okay. Now 3.
3, she has highlighted opportunities, which for opportunity, she said, consider adding communication aspects. I don't know how that comes under funding opportunities. Where'd it go? Do you? I don't know. I don't know what her train of thought is.
I think there was a general comment about you need to, the communication piece, you know, and I think it's as much outreach as you know, letting everybody know what's going on needs to be a part of this technical assistance program. The
Okay.
community.
Because 5, she had the communication is talked about in objective 5.
Yep. And I think that was updated. I think it was updated in our last meeting.
Mm-hmm.
So I think we're good there. Creating different work for the place where we have to local buildings, local communities, cities, and towns. So I guess we need to look at all of the.
So this is Liz. I'm just jumping around to the different meetings. I just wanted to note that, you know, the notes that are on the side, that's just what we did as we went through, and people are saying, well, maybe we could think about this. Maybe we could think about this.
Yep.
So they're for your consideration, you know, generally.
Yeah.
Yeah, we're trying to true up the language and dates and see if and where clarification needs to happen. Liz, we did hear Jane's request to, you know, really define what hyperlocal is. Can we include, you know, where do we include kind of that? Is there a bibliography or is there something in here where we talk about the definitions of our terms?
Yeah, we certainly will have a like terms list, a glossary, I suppose, that goes with the entire plan. But I do think that our plain language goals are to make sure that people know what we're talking about. So this came up in another work group. I was sitting with helping with the social isolation group, and they had that term all over. And they just said, well, people don't know what that term means necessarily, but what it means in the context of what they were talking about was neighborhoods, towns, and cities, right? They were saying this is where social connection work really needs to happen. And so they took out hyperlocal and put towns, cities, and neighborhoods. And that might be something that you guys want to do too.
Okay.
All right, Chelsea, since you're here, I've just been popping around too.
Okay. Yeah.
Liz,
They were the smallest group, so that's why I keep circling back to the.
Yeah. Liz, I wanted to ask you, in one of your comments, you said consider adding communication aspects. What's your line of thinking there?
So she popped off.
Popped off and just back on. What was the question?
So your comment under opportunities and in objective 3, you have consider adding communication aspects, but on objective 5, we have listed about communication.
Yeah, I think you can then disregard that if it's not relevant.
Yeah, I was just trying to follow your train of thought there. And then prioritizing community-based organizations over for-profit vendors. Can we do that in this?
That's a question to the group. Again, all of these notes are just things that people brought up as we were going through these. So I think one of the focus areas is just, our nonprofit organizations incentivized to be part of this process and our resources going to them. But overall, right, we're hoping to do public-private partnerships, and those can be done in a variety of ways. So I really think that.
November, I believe.
I just don't know that I can fit anything else in. I don't know anybody else. I can't even do, well, I could probably do again this Friday at 8 o'clock in the morning.
Yeah, next week I'm out altogether at a conference in Philly. So
yeah, I got 2 site visits this week. I'm on one now and another next week.
I could do an 8 a.m. on Friday. If anyone else, would that work for you, Israel or Linda?
I could probably.
No.
Let me see.
Also, again, the drive is open for you guys to go into and be able to those real, up to date edits.
Yeah.
The other thing to think about, and I I should be able to look at the changes that you guys have made and incorporate them into if I have to add anything to the questions, especially when it talks about the partners, and then really identifying exactly who those partners are, identifying funding sources on the federal government if you're doing that within the strategies, things of that nature.
Can I ask a question? For number 4, this is what my thinking was this morning, was that I agree with what we have written there, and I didn't know if this would be a sub-strategy or separate strategies, but so if we do that in terms of advocate policy changes, if we have policy changes that support intergenerational living arrangements in zoning, in funding and caregiving, and in existing limited programs, it could almost be, to me, it seems like it could be 4 things instead of 1 thing, even though I like how it's succinctly put together, because the players in each one of those are so different to try to get to start somewhere. So like if we were going to try for LIHTC, for example, for tax credits, that's starting with a relationship and conversation between HUD, Department of Aging, community development, and housing. You know, like there seems to me there's different groups that we would want to work with to start, even if they end up being more encompassing with more departments. But it occurred to me that we could probably break out number 4 into at least 4 different strategies. And I wanted to see what you thought about that before I put that in there.
That works for me. If it makes it easier to coordinate people around those policy changes, but doesn't keep people in silos. I mean, I think each one of these has to say you've got to address the funding silos and the limitations.
Right. But how you have it broken out, like number 1, where you have the strategy, and then you have A, B, C, D, and E. I think you can do that for that one.
Should do it like this. So we'll do, just as an example, I'm going to copy and paste this over and see if that,
right,
if it'll let me.
So it would you
But
would
I
put
would-
it within the 4.
Yeah.
But what I would be a little bit more
like that.
I think Chelsea wants timelines.
Yeah, I would put timelines, but also be detailed in who's the who in that. So policy changes, is it with Maryland Department of Planning? Is it Maryland Housing and Urban Development, you know? So I would be very detailed in that and identifying who your players are within this.
More like that. And then so this is something I have from a timeline question. And so, because I don't work in policy change as much, more in licensing code is really where I focused more of my regulatory side. What are the time frames for putting things in like that align with the calendar in the state of Maryland?
So when we are introducing new legislation or amending legislation, we have to get it in, I believe, by July. And then it goes into review for the legislative season, I believe, beginning in January. JJ, am I correct? JJ's actually has gone through this process currently. Let me ask JJ right now.
Because I think that would make it dependent that, like, okay, so January to July, you need to do X, right?
Right.
Yeah.
So you can say July 2025. Well, since this goes into effect, this 10-year plan goes into effect July 1, 2025. understanding the nuances with that. Like, are you meeting with your local delegates and council members, right? To start drafting either new amendments or drafting amendments or drafting new legislation. And then creating or reaching out to the departments that it directly affects to get their buy-in.
So you have like one, like for each of those topics for example, you'd almost have 3 breakouts down below that says identify departments, draft potential language, have a conversation, and then propose. Something like
Correct.
that. Okay.
So it can go into, so it will be sent to the governor's office to either get approved to go into the next legislative session.
Who do we send draft language to?
I would always start with your local government. So your local delegates, council members, things of that nature.
But the who here is the Department of Planning and Zoning and all
So-
those offices.
So
For this case, only because this was zoning. Yeah.
Yeah. So for instance, right, Delegate Wallach, Sarah Wallach, approached our Secretary of Aging with a piece of new legislation. And she worked with our department in drafting that new legislation. So
So you really
that
should
was
have
the
to-
very beginning stages of that.
Okay, so this does have to include Department of Aging as
Yeah,
the advocate.
I would.
Yeah, yeah.
Now, if it was like it would be collaboration
Yes.
between MDOA, planning, and
Your local zoning and planning.
yeah, and housing, right? So within that, are you so you're thinking about what is it that you're asking, and what are you asking the state to provide? So are you asking the state to oversee and fund XYZ initiatives?
And in this case, we're probably asking for a change to the zoning that allows for intergenerational living arrangements to be accepted
right
as by right, instead of this whole segregating by age.
So yeah, just making sure that you're being very clear on what your ask is.
That's a heavy lift for the zoning departments, actually.
It got to start somewhere.
Yeah, you got to start somewhere.
Right, and right. If they collate it and they know where these success stories is, because I think from that, you not only need the policy changes, but you need the stories, you need the PR, you need what it is that you're using to sell this issue, which goes to the public. Yeah. So we're about to be popped back in the main meeting in 3 minutes.
So you're not the only group that's trying to codify
Correct.
legislation. So this is
Israel-
right on.
Oh, okay.
Israel had his hand up.
Yeah.
Yeah,
Israel?
and sorry to throw this with 3 minutes left. I just want to make sure we're not cutting our nose off with the term intergenerational again. I know we've talked about multi, and there are people that do provide caregiving across 2 generations, and instead of focusing on that's easier to just add it.
Thank you. Thank you. Terminology is everything. This is why we all got to get vetted in, in order to get through this. Old terms.
It does. You're right, because that's definitely going to impact the incentivize the caregiving part.
Yeah, exactly.
Yeah. Okay. That's going to take some more work and thought process for this. Is there anything in number 3? Because we kind of tried to do that, but we didn't get to number 3 at all. Is there anything in there targeted outreach strategies to engage underserved communities. I think this is super important too, right? So,
Yeah.
okay, 2-minute charge. Anything?
Israel, are you available on Friday at 8? Maybe Chelsea, if you just send us a meeting notice, and if it, whoever can come can come.
Yeah, I'll be driving to an appointment by 8:30, but I can at least
Sure.
dial in and have
Great.
audio.
Okay, excellent.
And my question for this one is,
Yeah.
Are we engaging them regarding what?
Oh, this is the
So
outreach.
this
For number 3.
this stemmed from excuse me.
Mark.
Yeah.
Oh, Craig. And
Sorry.
Mark.
I'm over here choking. Yeah, this stemmed from what Mark was bringing up.
Oh, okay.
And it would be supportive because we didn't really tie that back to the facilitating dialogue. So this is it facilitating dialogue. That's where the engage part comes from, right? Is there something that what would be the steps, I guess, if we were going to engage underserved communities? And so part of that we've found through like community colleges and universities, for example. That's how we've done some work in Allegheny County. And that's how we engaged folks that hadn't been heard before.
Is there any sound?
There is sound. We're just waiting for everyone to come back in.
Okay.
All right. Welcome back, folks.
Hello.
Hi. So I'll go ahead and move forward. The next item on our agenda is to spend some time reporting out on our conversations where we're leaving off in each of these work groups. We only have about 20 minutes, and so let's go ahead and go around. Is there anyone who wants to kick us off?
I'll go ahead. Since we're first here. Does this get me what I need? Okay. So ours was is the engaging local communities, hyperlocal strategies. And I just lost my mouse. There we go. Sorry. We I'll just talk about the changes. We did not make a whole lot of changes. The main things are we tried to true up the dates and based on our last week's discussion. So we still wanted to keep the short-term date of by 2026 because we felt that, putting a 10-year date out there, says we don't have a sense of urgency, but we want to make sure that by 2026 we have that longer, short, medium, and long-term strategy. So we changed the language to match that. Any comments on that? We didn't change anything in the body of the strategies. What we did do was add a definition of hyperlocal because that was a recommendation. Do people understand? I don't know if there's going to be a glossary, but at the very bottom of it, we defined hyperlocal models of community building, aging as community development strategies, small geographic areas, neighborhoods, or even individual houses that address concerns. And again, creating networks and resources that take care of aging residents. So if we have a glossary, we were looking to put it in the footnotes or even somewhere in the body of this supporting documentation underneath the strategies.
Wonderful. That's very helpful. Thank you.
Okay. But that's all, those are the only changes we made, so I don't want to take up time unless there's comments.
Any questions or comments for this group? All right, let's go to the next one, which I believe is maybe local governments. Do you guys want to go next? Can anyone speak on that behalf? It looks like we lost some folks coming back into this main meeting, so we might have lost them. Hopefully people will join back on. Hey, John, we were just going to move on to the local governments to do the report out. Is there anything you'd like to share with the full group in that discussion?
Sure. I'm sorry, I have some background noise. Sorry, Steph, I don't have the document in front of me, but we prioritized our recommendations down from, I think we had originally 12 down to 9. And we are suggesting that one of them be given to the multi-generational subgroup as a strategy that's related to ageism. And actually, perhaps, Steph, you could sort of summarize that. I'm sorry to piggyback on you, but that one strategy I do want to mention because we thought that it might be good for the multi-generational subgroup. I just don't have the document in front of me because I have this response.
Yeah, absolutely. Thanks, John. Yeah, we have a lot of strategies. So we were thinking about where potentially there'd be really good overlap. And we thought our strategy around creating a comprehensive ageism awareness and training program would sit really nicely with the multi-generational work group because this is so foundational to building those relationships across generations. Of course, it's relevant to each of our subgroups, but thought that if we need to be moving strategies around, that could be a nice fit.
Thank you. Can you share with me which number it is so we can make sure that we're sharing it with those folks?
So it should be number, if that's the same document we're working on, it should be number 10, Liz. Do you have a, yep.
Wonderful. Got it. Thank you. I'm going to put that language in the chat for folks for awareness.
And then we have some additional information that we'll be providing in the supporting information section that we're going to try to take care of tomorrow. But it's going to revolve around capacity issue of agencies to be able to handle all of the information and referral that's going on, as well as we have some comments to add on funding. And Steph and I can work on finals and have it done by the meeting next week.
Wonderful, thank you. And that came up at that in the discussion group is, when do these have to be done? I think we can talk about that further in next steps. But my strong suggestion was if we could please, as our groups, wrap everything up by this Friday so that the stakeholder advisory group, when they meet next week on Tuesday, is able to sort of see everything that's been actively recommended from the groups, and they could kind of think about it from that perspective. Okay, so multi-generational relationships, a suggestion for you guys to include, and can you tell us a little bit about what's going on in your conversation?
So we are going to try to meet again this Friday. Chelsea's going to send us an invite, but I am going to ask Jane to report out because she did most of the transcribing. I think that would be very helpful. Thanks, Jane.
Yeah, sure, Kathy. Liz, could you pull up the combined document because it's all in there? And I copied what you gave us from the other group into the document too while we were talking. Because that signs up with that. And we made tons of changes in ours. So for those who weren't, we're basically trying to break it down with a timeline to it.
Is it in the copy version or the original?
No, it's in the chart in the table.
Okay, let me.
There you go.
Get down there. Is it this one?
Yeah, go up to the top part of it. So it came about the who, what, when, why, all that, trying to do all those because I think the strategies are very succinct, but they have a lot packed into them. So we broke them out by like in 2025, this is what we're hoping to do by 2020, et cetera. And then the last one, I think we decided to be more specific in the, number 3 is going to need some work because we didn't get very far on number 3, but 2, we got some work done. 3, we got a little bit of work done. But then in 4, we took the different policies because there's different groups that would be involved in that as an initial review. So for example, if we wanted to get a zoning change, that's MDOA, but that's Department of Planning, that's local zoning planning, and that's the Maryland Department of Community and Housing Development, right? So then what's the groupings for that? And then we have another one on policies that are include funding for supportive of intergenerational arrangements. So the funding piece, like breaking down the silos, how do we identify the departments, and then draft language, et cetera. And then we did one for caregiving, and then the last one was the programs that we talked about. So the idea would be on Friday, we would hope to broaden those, right, Kathy, that we would kind of fill in some more of the detail. I might be able to do a little bit of that before Friday, then we can review it and try to get that. But it was a really robust dialogue. We got a lot done in an hour. So that was great. So I don't know if anyone has any questions or not, but we're trying to give more detail, timeline, the who, what, where, and when, and who we would suggest to help us with that.
We also tapped into this Maryland Think. We thought that and that's probably something that may go across all of these topics, is that if there's already this new entity that's going to be working on dashboards, how helpful they will be and where that information comes from.
Great. I would encourage this group to think too, whether and how some of this information should be in sort of the supporting information and what goes into the strategy specifically, so that we can kind of lift and use them so they're concise. So just think through that. I'm not giving you direction either way, but some of these, what types of organizations are involved or specifically asked within those 8 questions. And you can always kind of take the question strategy by strategy if you find that they really are disparate. Good. So it sounds like you have another meeting planned for Friday. That sounds good. And then our last group is are there any other questions for this group? Okay, last group is age friendly.
Yang, are you able to share the screen, please? I think yes, maybe.
Yeah, I can pull that up too because I have it open.
Okay.
Oh, you got it? Never mind.
Oh, yeah. Okay. So similar to other groups, we also kind of prioritized our strategies, and we wordsmithed them to be stronger. To be much more declarative. Yeah, something of that nature. Anyway, we wanted them to declare, yes, we are going to do this, and be stronger in the presentation of that. So we had great success with that. We went through, and then we started with 10 strategies. We got that down to 9, but we also spent a good bit of time taking a look at the dates. And for many of our things, we did have FY 2026 and ongoing, because many of the things that we suggested as strategies would be ongoing in nature. It's not a once and done. We're going to be committed to this yearly and forever. That's the goal. So did a lot of good work on that today. Really appreciate all of the group's wisdom and making that happen. And I think we also took a quick look too at our supporting documentation, and we felt like we're in good shape with that as well. So very much looking forward to hearing the next steps, but really excited for the opportunity that we had to participate in this group.
Wonderful. Any questions or comments overall, items that you are, for example, seeing that you think you're seeing in multiple subgroups that maybe we want to think about structurally bringing those out as cross-cutting issues? Anything like that?
This is Jane. I think that one about the database, I mean, I think we're all in agreement that we need a database and that it needs to be easily used. It needs to be consumer facing and resource development heavy, but easy to use. I mean, I hear that all the time in all the segments we work in, is that it's just not easy enough to use, or it's not accessible enough. And then I was curious, just from experience perspective, of how is that going to continually be updated, because it can't be stagnant. It has to be an ongoing thing all the time. And who and what is the designated group, and how is the funding flow, and how do we make sure of that? And is there a place that you can upload and say, here's 5 things that would go into the intergenerational resource tab, for example? And could it be divvied up similar to how we've divvied up the 4 groups that we had, or 5 groups that we had? Could that be divvied up so that there's tabs that show, and this is how it used? I mean, for me, it's about the usability, I guess, but also having enough of the resources available so that we're not missing anybody, but it helps all the agencies and departments make decisions, but it also allows consumers to make decisions or get what they need. Does that make sense?
Yep.
Is that right, Kathy?
Yeah. To dovetail with that, before we get to Norman, there was a comment made about there's no wrong path. I can't remember what the term was that somebody came up with.
No wrong door. Yeah.
No wrong door. And so having multiple access points are really key there. So Norman and Carol, I think you have some hands up.
I think there has to be an overriding emphasis over all the components of it, from marketing and communication of it. Marketing, because we can have all this stuff, and if people don't know about it, and I'm not sure that came out in each of the segregated groups, but that should be an overriding concern in the presentation.
Carol?
Yes, I just wanted to thank your group, Catherine, for putting some language in about legislation, because we talked about it within our group and we realized that it was important. And if your group and if it stays in your group, what stays in your group, stays in your group. But it's really important to say that somewhere in here, because there's going to require legislation in order to be able to do a lot of the things that we're recommending.
Thank you. Real quick, Catherine, before we get to you, the other thing that we kind of also started with, but I'm not sure we actually put it anywhere, was, in this environment on our state budget and, not knowing where the federal budget's going to be, we really need to be finding and highlighting those pragmatic approaches and the more crossovers that can happen. And some communities may have access to thousands of dollars and tens of thousands of dollars. Others may have $1,000 to work with. So what are the types of programs that are those that can be really community driven without a lot of extra costly resources? So Catherine?
Thank you. So the communication piece, certainly, and the marketing piece was something that we had in ours, but we're trying to beef up a little bit more, knowing that it's probably a common thread for everybody. Because the communication, the ongoing communication, the use of a variety of communication tools, and I mean, although we talked about DEIB issues, I mean, certainly in multiple languages, I mean, there's so much to be done with that. That is a huge chunk of, I think, that we all can agree on. So the communication we have in common, the database, the website, there are many things that I think that we have in common to make this strong and sustainable, because the sustainability is everything. But Kathy, you brought up too about the funding, and we certainly looked at various funding streams from all different areas. But also, it really talks about, let's look at braided funding and how we do that, on a state level, how we use braided funding on a local level. And I think, on that website, in terms of best practices, there should be like a whole section about, here's what we would recommend, because there are local funders I know that are particular to Frederick that I know so well. But I think there's local funders in every county. It's just a matter of, how robust their finances might be. But really looking at that, and I think on a state level, looking at the braided funding, because I think that is just so key here. But it also sets an example. That's what it's, the collaborative and the collective working together. So I don't know. I think this is a great opportunity to be the best of Maryland.
Does braided funding mean funding that's literally braided together? Is that what that means? I've not heard that term before.
That would be like, for instance, say, because in my preferred vision, and I think of the age-friendly vision, that there is a staff associated with this, and that was part of the things that we put in our strategies, that there's a staff associated with this, and that staffing, I can see easily writing a grant to a national funder, a national nonprofit funder. And from there, say it's $1 million, then we might say there's sub grants for that within the county. So the county's going to pair some of their money with some of the federal money, and even maybe some of the state money, and some of the grant funded money. There's ways to kind of to draw this together. And Liz probably wants to speak more about that, because I hear, that's such a hallmark that MDOA has in terms of looking at the variety of funding streams and how we can leverage that for the better. But Liz, go ahead, and I'm sure you have comments on that.
Well, I just wanted to do a time touch to it. We got about 5 minutes. I know we want to talk about next steps, but I don't want to cut the conversation off. And I just wanted to say that certainly braiding is combining multiple funding streams, and that, local agencies are experts at that, right? And we're still working on that at the state level. Any last comments before we move into this final section?
So, and I want to thank Liz, who has posted a few things on the message board about, those resources in the dashboard. But one of the things we want to be real cognizant of is that sometimes what helps older generations, also there's a need for support for younger generations. We just talked about a presentation that was done specifically for VA caregivers. And so when we think about veterans, we think about older generations, but really, it's the family and what is needed, and that type of multiple supportive. They've actually got a really great starfish model where there's just different groups, and you can come in from any group and you wind up with expanse of different programs there. So I'm done now. I'll go on mute.
Okay, one real quick thought. When we were talking within our group, there was always this question about folks who are under and jurisdictions that are under resourced, and that things are not equal. I would like to think about, and Liz Woodward, this might be something that you could look at. There, at one point, there was like a pot of money that could be designated to under-resourced counties, or where there's more poverty. And if we could use, or even recommend, that there be some sort of pot of money established that the MDOA could then parcel out based on needs among those under-resourced counties. It would be a way, I think, to at least include something to try to balance out, so that it creates more of an even availability of resources.
I think it's also worth noting that there's a lot of thought going into how to define eligibility and how to develop data-based allocation formulas that take into consideration elements and pieces of data that haven't historically been taken into consideration. So I think it's a really important point on how we're actually targeting and allocating our resources so that we're leaving no one behind. I know a lot of state agencies are thinking through that now. So I want to thank everybody for this really robust conversation and for all the work that you've been doing. I want to acknowledge that this work group in particular has really taken it upon yourselves to meet outside of our standard meeting times, to really come together and work on your recommendations. And so I know you've invested a lot of time into developing these recommendations for the department's consideration to be included within the plan. And we really appreciate that time and that consideration that you've had. Thank you very much for joining us in this process. So next steps, I am asking everybody to finalize their recommendations by Friday. And I'm asking a point person to please email myself and Chelsea and copy Pazit to alert us when your group is done and where we can find your recommendations. So I heard some folks are working within their working folder, some folks are working on that main document, and some people might even have a Word document you're working on. So just let us know where we can find those final recommendations. We'll be bringing them together. And then we have our last stakeholder advisory group meeting on Tuesday. These meetings are only an hour, so we won't be going into every single detail, but we'll be making the full scope of the recommendations available to the stakeholder advisory group, talking to them about what the recommendations covered, and then talking about next steps. So are we kind of complete, or do members of the stakeholder advisory group want to do some additional work and scoping on that within the short time frame we have? And then we'll be really talking through next steps as well, which I've shared with you. We have this timeline that stretches out to spring, where I think our time frame is about mid-March now to go out for public comment, which will be open for a 30-day period. And then we'll be working on analyzing the responses we get, adapting the report to acknowledge them. And the final report will go for governor and federal review, and the target date for posting is July 1st. And that's when implementation starts. And depending on what comes out in these recommendations, the implementation is going to involve a number of different partners and target groups, and we'll be working on developing a plan for that. But we'll be kind of previewing some of our concepts at the stakeholder advisory group meeting, and we are interested in your recommendations and suggestions as well. So if you're not signed up for our newsletter, please sign up. If you have thoughts already on here's what you should be doing, please let us know. We've got lots of ideas for how to make that implementation stage work effectively. And I'm sure you have lots of thoughts too. So if those your recommendations don't make it directly into your supporting information, please feel free to reach out and communicate those to us as well. And I encourage everyone as well to join the stakeholder advisory group meetings as, live streaming and listening in so that you can hear that full update across the group. Because I know, especially this group, your recommendations really bridge the full scope of Longevity Ready Maryland.
Liz, could you send us, you sent out the most helpful letter early on that had links to the various, the advisory group, the stakeholders group, and a link to the document that's sort of finished up. And if we could have those things so that we could click on them without having to go search for them.
Yeah, so that is in the working folder, in your work folder, and I will send it to you again. I'll forward that on. That's our resource packet for the groups.
Thank you.
Of course. All right. Thank you very much. I hope everyone has a wonderful rest of your day.
Thank you. Bye-bye.
Bye.
Thank you.
Thank you.